Okay, so today we are going to talk about the scores in subarachnoid hemorrhage. I have started a series of videos on scores in stroke. So I already uploaded a video on intracranial bleed, and in which we take the score that is called intracranial hemorrhage. So today I'm going to talk about the subarachnoid hemorrhage and the scores and the significance of these scores which we find in subarachnoid hemorrhage. So let's talk about it. So let us talk about it. The two score which we are finding in subarachnoid hemorrhage, that is H and MFS. But first of all, we got this patient, 50-year-old female. She was presented with severe headache and vomiting from last 2 days. Upon we were suspecting subarachnoid hemorrhage, so we did CT brain. On the CT brain, we got these hyperdensities. The hyperdensities in Sylvian fissure, the hyperdensities in cisternae. You can see these lines in line form. These hyperdensities in line form. They also saw interhemispheric, a bit interhemispheric hyperdensities, and Sylvian fissure the densities, and cisternal hyperdensities. So all these hyperdensities show subarachnoid hemorrhage. This patient was diagnosed with subarachnoid hemorrhage, and we are going to find the two scores in subarachnoid hemorrhage. The one is called HNH, the another is called MFS. As this patient was diagnosed on CT brain, we diagnosed the patient with subarachnoid hemorrhage. So the next investigation, as I already explained in many videos, we do CT angiogram, because this majority of causes for SAH are aneurysm. So this CT angiogram will show us aneurysm, and upon doing CT angiogram of this patient were having right MCA aneurysm. So the two scores which we have to find in subarachnoid hemorrhage, this is called HNH, which can also be called Hunt and Hess classification, which predict the mortality of this patient, and another score which is called MFS, modified Fisher scale, which show us the risk of vasospasm, because if we see here, if this is a porta brain and this is supplied by this blood vessels, after subarachnoid hemorrhage, our bodies starts to constrict these blood vessels, and if this blood vessel is constrict, then the blood flow to this area of the brain will be decreased, and this is what we call that vasospasm. And if the stroke occur at this layer, that will be called vasospasm induced infarct, because the blood flow will be decreased. So the mainstay of treatment for subarachnoid hemorrhage is to protect the patient from this another infarct. So we give the therapy for vasospasm to reduce the vasospasm or to protect the patient from vasospasm. For that, as I already say, we give solestazole, that is Platal 100 mg BD, and another one that is called nimodipine or nimutap, which we give 60 mg 4 hourly, and these two drugs we give it for at least 21 days, because the vasospasm, chances of the vasospasm are from it is very high from the start of first week to, at the start of second week, and at least for 21 days. So that's why we give this vasospasm therapy like nimutap and Platal, which can be also called amlodipine and solestazole, for at least 21 days. Now let us talk about these scores and how do we find, like for this patient, what will be the HNH and what will be the MFS. For scores in stroke, now we are going to talk about the score in subarachnoid hemorrhage. For all the scores, you have to download the med calculator from Play Store. Now let's open it. As you open it, just give HNH, in this, and you will find this score that is called Hunt and Hess classification. Open it. Now as we open it, we have to look for this. Like if the patient having mild headache, alert, oriented, the score will be +1. If there is neck rigidity, moderate to severe headache, then will be +2. Just look here what your patient is having. Like for my patient, the patient were having rigid neck and moderate headache. So for that, the score is going to be 2. Like here, this one 2. So here I am going to write the score 2. Now this was for Hunt and Hess classification. So now let us talk about the MFS, modified Fisher scale, which also show us the vasospasm risk for this patient. So we find HNH, now we have to find MFS score for this patient. So you just have to come here, the medical calculator, and we have to put this. Now you can see here modified Fisher scale. For this scale, they are asking you if there is no SAH on CT brain, or focal or diffuse thin SAH, focal or diffuse thick SAH. So for this patient, the SAH is going to be focal and thick. So we will just click here for this. Now they are asking us that is there is any intraventricular hemorrhage or intraventricular extension. No, because you can see here the ventricle are okay, you can see the CSF black, so it means there is no bleed or there is no bleed or hyperdensities in the ventricle. So for this we will put it here no. Now they are showing us this patient is having grade 3 MFS, which is have 33 to 35% probability of symptomatic vasospasm. So we will say the MFS score for this patient is 3. So this is how you have to find it, depend on practice. If you do more practice, then it will be very easy for you to find the H and MFS score. Thank you.